Dear APPNA family members and members of our local communities, I am Dr. Harun Durrani, Secretary of APPNA for this year. I welcome you to the first of its kind webinar by APPNA. As you know, these are unprecedented times in the world as the health and lives of millions of people is at stake due to coronavirus pandemics. While governments are waging a war against the pandemic, healthcare professionals are acting as their frontline soldiers in 190 countries. APPNA, being the second largest organization of expatriate physicians in USA, has stepped up to the plate at this critical time. Raising funds, providing food for poor, securing PPE for fellow physicians in Pakistan and USA are efforts led by Social Welfare Disaster Relief Committee and newly created COVID-19 task force. Educating our public is a very important step that is being undertaken as well. Today's webinar is meant to provide important information to general public by experts and to answer some questions which may help in saving lives and keeping people safe from the viral infection. Let me introduce you to our participant today. We have Dr. Naheed Usmani, who is President of APPNA. We have Dr. Rizwan Khalid, who is President-elect of APPNA. We have His Excellency Ambassador of Pakistan, Dr. Asad Majid Khan, who is going to appraise us with the things going on in APPNA in Pakistan, and also the steps taken by the government as well. And as you know, that APPNA is also collaborating with the Pakistan embassy over here and doing efforts in Pakistan as well. Just a little bit of housekeeping before I introduce my panel. Basically, I will give 1 to 2 minutes to our guest for the statement. And after that, we will turn to our panelists, the panelist questions. We will try to answer as many as possible, but this webinar is for 1 hour. And can you hear me?
No, we missed.
Yeah, you are back now.
I'm back now. Sorry, it got dropped. So our panelists today are, we have Dr. Sajid Chaudhry. He's an infectious disease specialist, clinical assistant professor, University of Central Florida, Orlando, chairman, Department of Medicine, Ocala Regional Medical Center, Kissimee, Florida, and chair APPNA COVID task force. And he's also the past president of APPNA in 2017. We have Dr. Asim Shah. He's a professor and executive vice chair, Barbara and Corbin J. Robertson Junior Chair in Psychiatry. He's chief division of community psychiatry, Menninger Department of Psychiatry, professor, family and community medicine, Baylor College of Medicine, chief of psychiatry, and he's a director, community behavioral health program, executive director, psychotherapy services as well. And our third panelist is Dr. Sajid Mahmood, board certified in critical care medicine. He's a consultant intensivist with OSF and Memorial Health System, consultant intensivist with Advocate-Aurora electronic ICU. So first of all, I will request Dr. Naheed Usmani to please make a statement.
Can you hear me?
Yes, we are.
Yes. Assalamu alaikum, everyone. I'm Naheed Usmani, President of APPNA. First, all of you have my sincere duas that you stay safe and well. Thank you for joining this webinar. As Dr. Durrani mentioned, there are 18,000 Pakistani American and Pakistani Canadian physicians who are at the front lines of this epidemic, treating the COVID-19 patients directly, or we are trying to change our clinical practices by changing to tele or video visits. This webinar is another effort to answer the community medical questions and to help you cope. In addition to our work as healthcare providers, APPNA is fundraising and providing direct assistance to affected populations in US, Canada, and Pakistan. We have raised about $120,000, and our 49 chapters and alumni have raised additional funds. And in US and Canada, we are focusing on food assistance with the ICNA food pantries. We are also trying to advocate for providing personal protective equipment to the healthcare providers. In Pakistan, we are offering food assistance through Selani and Ahua Trust, our local partners. We have already delivered food to more than 2,500 families already. We are also helping the health professionals in Pakistan, trying to find personal protective equipment, etc., from domestic and Chinese vendors that can be delivered to all the major teaching hospitals. APPNA Merit is also creating teaching and training lectures and videos on management of COVID-19 and ICU patients for the physicians in Pakistan. Our advocacy committee is helping the young Pakistani graduates, about 200 of them who have matched for residency in US and will need visa assistance. So please, thank you for joining on the webinar. Please be safe. Let us all work together to help our communities cope. I hope with that our team will answer your relevant questions today. Thank you.
Thank you very much, Dr. Nahid Usmani. Next, I will ask Dr. Rizwan Khalid to make a brief statement.
Assalamu alaikum and good evening, all attendees today, physicians of Pakistani descent, APPNA members, other physicians that have joined us, and the Pakistani diaspora here in Canada and the United States. My name is Dr. Rizwan Khalid. I'm the president-elect of APPNA. I'm an associate professor of cardiology at KCUMB and an interventional cardiology and electrophysiologist and Ascension Via Christi Hospital. I work on the border of Kansas and Missouri. I would first like to thank from the bottom of my heart all our physicians and nurses that are on the forefront. We are very proud of you, and we see the work that you are doing day in and day out. So we owe you a debt of gratitude. There are many APPNA members that some of them are on this panel today. There are so many others that are working in hotspots area in the United States, whether it be Seattle, whether it be Chicago, Central Florida, New York, New Jersey, that are on the forefront of taking care of this nuisance of COVID-19. APPNA, the stuff that APPNA has done, and APPNA EC, Dr. Nahid Usmani has already summarized those, so I will not go into the details of that. But again, I want to recognize the Social Welfare and Disaster Relief Committee under the leadership of Dr. Aisha Zafar and the COVID-19 Task Force under the leadership of Dr. Sajid Chaudhry for the efforts and the amount of work and the volunteerism that they and their teams have showed. I would also be amiss if I do not extend my gratitude to His Excellency, the Pakistani Ambassador to the US and his embassy staff who has helped us and coordinated in the relief efforts. Lastly, I would like to appreciate Dr. Harun Durrani. This town hall webinar was his idea, and thank you, Harun, for organizing and moderating it. Again, this is not going to be the first. This is not the last. We will have other webinars from time to time. Thank you, everybody. Thank you very much.
Thank you, Rizwan Khalid. Now I would request His Excellency Ambassador of Pakistan, Dr. Asad Majid Khan, to make a statement. I think your voice is muted. Yeah.
Okay. Well, thank you very much, Dr. Durrani, for organizing this webinar. And I would, of course, first of all, like to avail this opportunity to thank the entire APPNA leadership for coming forward in the way that you have actually. Our gratitude to you all as physicians, as doctors, because you are the front line in this very, very unusual, extraordinary situation that we face around the globe. So for you to spare time, for you to do things that are way above and beyond your call of duty is worthy of appreciation. So I salute you for that dedication, devotion to your adopted country and also to your homeland. I have always been a fan of APPNA. I can only say that I am a more consummate convert now than ever before. It has also been a pleasure to work with the APPNA leadership in organizing and coordinating your relief activities and assistance in providing some of the stuff that we direly need in Pakistan. I know you have your families, your near and dear ones still in Pakistan, and you are all worried about the situation there. I can say that by the grace of God, so far, I think things are pretty much under control, and the system is gradually getting ready to deal with and is ready to actually deal with any possible worst possible scenario. As of today, we have about 1,564 confirmed cases, and there are 15 reported confirmed deaths in Pakistan. Government has taken a slew of measures, you know, in terms of restricting people, limiting flights, those coming in, those going out, domestic travel, schools, colleges. So all of this, I think, has helped in keeping the numbers low, because this is even in Pakistan, what, about fourth week that we are into this extraordinary situation, but numbers are still under control. And I must say that our expat community members, international community has also come together in extending support and assistance. US government has also extended special assistance and support to Pakistan. Some of our other friends in the region, including China, has also come forward in providing some of those very critically needed supplies. Here, I must say that we are in touch with our community members. There were some stranded families that we are in touch with. We have assured them of our support, assistance, and cooperation wherever they need it. Flights are still suspended, so they may have to spend a little more time here in US until the international flights are restored. But those of you who have still families, US citizens in Pakistan, the US Embassy, I understand, is organizing the return of those interested in leaving Pakistan, and there are special flights. So I have said this before also, that for that, you may wish to coordinate with the State Department and the US Embassy in Islamabad. But in case you need our help and assistance in communicating the names of those who may actually be interested in coming out of Pakistan, we will be happy to work with all those who may wish to have that kind of access to the US Embassy in Islamabad. Our consulates, all 4 of them, are also very active. We have, despite all the challenges that we face and the emergencies declared in most jurisdictions, our consular operations are still on. We are, although encouraging everyone to avail the online services and facilities and avoid coming to the embassies and consulates, and come only when it is absolutely essential. I just want to avail of this opportunity to once again convey to all the listeners and those who may listen to the recordings later on, that we are here to support and help anyone who needs any consular assistance or support. And those that are stranded are being looked after, and we are in touch with the families and with those who are staying here to make sure that they are able to take the first possible flight whenever the flights resume. So I'll stop here. I thank you once again. Dr. Durrani said something during our first teleconference that we did with APPNA, that education, 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 and prevention, prevention, and prevention. And I think this webinar helps us educate ourselves. So I would not take any more time, and I let the panelists educate all those who are listening today to this webinar. So thank you very much once again for having me on the webinar.
Well, thank you very much, Mr. Ambassador. I want to thank all of my guests today. You are welcome to stay, but we are going to move to the second portion of our program, which is statements by the experts and then question answer session. So with that regard, I will ask Dr. Sajid Chaudhry to please make a statement.
Assalamu alaikum. Thank you very much, Dr. Durrani, for taking the initiative to arrange this webinar for awareness of our Pakistani American community and the wider public at large in US. This is a pandemic which happens in once in a lifetime. People, they may or may not see even their whole lifetime. We are seeing this magnitude after 1918, the pandemic from the flu. The way it's progressing is due to the infectious nature of the virus, and it's highly infective and communicable. Starting from the mid-December till by the end of the March, we have over 700,000 people confirmed all over the world, and it's we're still going towards the peak in US. Right at this moment is over 138,000 people infected. So as some of the guests mentioned, best prevention is stay from each other, social isolation, social distancing, which I think has been delayed to act upon that in different countries. That's why we are seeing that magnitude number of patients. I will briefly go over towards the symptoms of this disease. COVID-19 is the coronavirus, SARS coronavirus 2. It's the actual virus which is causing the disease. And the disease is the coronavirus disease 2019. That's abbreviated as COVID-19. Most of the patient, they may be asymptomatic or mildly symptomatic. They will have mild fever, low-grade fever, body aches, tiredness, dry cough. And as the disease progresses, then they develop the more deep cough, again dry, start having with shortness of breath. And then they develop pneumonia. From the mild pneumonia up to the level where they can go into the respiratory failure and will need intubation. We are seeing most of the patient with the mild to moderate symptoms. They're coming to the hospital. I can go towards the treatment part, which because I've been taking care of those patients. At this point, we do not have any definitive treatment available for this disease. We have different options, modalities available, which we have been using or have been used in China, in Europe, all over the world. without any significant confirmed data that there will be there is some improvement. Though in my personal experience, I have been seeing some improvement on hydroxychloroquine and azithromycin that we have been using in mild to moderately symptomatic patients. Whether the patient they're recovering on their own or they get better with the medicine is hard to see unless we have a randomized placebo-controlled trial where we can confirm the efficacy of these medications. Once again, my message will be to all of you who are at home, please stay at home, follow the directions of your local and social distancing. Anybody who has those kind of symptoms, unexpected low-grade fever, body aches, tiredness, dry right away should isolate from the rest of the family, friends, and stay at home. Unless you develop shortness of breath, then you should be in the hospital so you can be monitored for the progression of the disease if you need any further help. I will stop here. Thank you.
Thank you very much, Sajid. I will ask Dr. Asim Shah to give a statement. I think you're muted, Dr. Shah. We can't hear you. Okay, we will try to fix the audio of Dr. Shah. In the meantime, I will ask Dr. Sajid Mahmood to give a statement.
Assalamu alaikum, everyone, and thank you to APPNA leadership, Dr. Nahid Usmani, Dr. Rizwan Khalid, and Dr. Harun Durrani for arranging this much needed and very helpful webinar that would be helpful not only to general public who are not related to healthcare facility, but also this is going to be helpful for physician community. As we all know, this is a new experience for most of us. We have come across diseases in the past that has affected a proportion of country, MERS with like Middle East respiratory syndrome and SARS-1, but the disease of this magnitude, which has expanded to the pandemic level, is once in a lifetime experience for most of us. And as Dr. Sajid Chaudhry mentioned about the specific terminologies and viral illness, so I'm going to focus mainly to critical care aspect of this disease, as we all related to healthcare facility are experiencing that very small proportion are asymptomatic, but people are coming to the hospital and seeking medical advice for mainly respiratory illness. And as of now, the hospital where I'm currently at, out of 30 ICU beds, almost like 80% are occupied by similar patients, with half of them requiring mechanical ventilation. And I have to make a point here that even though underlying comorbidities or illnesses predispose to this, but we are also experiencing totally healthy people who are affected by this disease. And we are using, of course, ventilator support and our critical care knowledge to help these unfortunate patients. But as far as specific treatment is concerned, and Dr. Sajid Chaudhry has mentioned earlier that we don't have much proven medications or options in this regard. In my hospital, I have been working closely with infectious disease service, cardiology service, and nephrology services, because once this disease affects a systemic status, then it start affecting multiple systems. So it requires a multidisciplinary approach to help control to those patients whom we can save. And the jury is divided as far as specific antimicrobial agents are concerned, even though there has been a lot of hype and news, even in social media and general public, about hydroxychloroquine and some antiviral agents that had been previously used for HIV disease, yet definitive recommendation or report is missing here. As of now, I did talk to one of my colleagues earlier this morning, and even though Italy has suffered a lot, but because of the magnitude of illness and it took a brunt on their health proportion, health care department also. So most of the studies which are coming is from China and United States. And those are, sometimes they have contradictory information. One is supporting others, while the other is in favor of some other agent. So things are not crystal clear as far as clinical management is concerned. So we are learning something new every day. As far as my colleagues in pulmonary and critical care services are concerned, we are trying our best to be proactive as soon as someone develops respiratory symptoms. And our first attempt is to avoid mechanical ventilation if we can. And if someone goes on mechanical ventilation, then we try to control hypoxemia, which is deficiency in oxygen, in its earlier stage, so that we can prevent the progression to ARDS, which is acute respiratory distress syndrome, because once patients get to that point, then they are unfortunately not salvageable. And as I speak, one of the patients that I took care of 2 weeks ago, same on Sunday, intubated, and unfortunately he, despite our best efforts, including mechanical ventilation and prone positioning, which is like laying patients upside down on their belly and chest in order to distribute oxygen well in the relatively healthy areas. But unfortunately, he succumbed to his illness and expired earlier today. So I want to take this opportunity to also bring some statistics that would be interesting. So as of today, the total number of cases worldwide is 717,695. And because this webinar and the panelists, and also we are lucky to have Ambassador Asad Majid Khan also. He spoke about Pakistan. So I'm gonna give Pakistan numbers, as he mentioned, that 1,597 total, out of which 14 deaths and 1,554 are active. And in United States, the number for today is 138,947, which has surpassed Italy and China like a couple of days ago. And as of today, the total deaths in United States is 2,438, and new deaths in past 48 hours are 756. So the numbers are alarming for United States, and of course, the Center of Disease Control and other state agencies are issuing guidelines on a day-to-day basis. So we have to be, keep ourselves in touch with them and follow their guidelines and, help the best possible way. For general public who are connected today, I would strongly advise to contact us through this webinar or other addresses, and also visit Center of Disease Control website, which is www.cdc.gov/coronavirus 2019. So they have very helpful guidelines as far as daily hygiene precautions and what do we need to do. And so they have very helpful resources which can be of benefit to both healthcare and non-healthcare staff. Thank you very much.
Thank you very much, Sajid. I think Dr. Asim Shah is back. Asim?
Yes, I am. Can you hear me?
Yes.
Yeah, thank you. Sorry about the error in the beginning. So first of all, thank you, Arun Bhai. Thank you, Investor Saab, Sajid Chaudhary, and Sajid Mahmood. Whatever we have heard so far, of course, panic is normal. And some amount of panic is, of course, normal in this situation. But as the novel coronavirus is spreading and spreading more and more, the panic and anxiety and the worry is going to be more and more. It's rising. It's rising immensely to the point that now what we are seeing, the disease is definitely huge and big, but the panic is becoming even more than the disease. And part of that is because of news media, that you watch the news media and you see the same image again and again, and you see the breaking news again and again, and you see the number of deaths, and people become obsessed into looking into how many people are affected by this and how many people will be affected, and the models and the charts, and that definitely causes a lot of panic. I think Dr. Chaudhary mentioned social distancing, and people are worried about social distancing, but people need to be assured that social distancing does not mean social isolation. You can still be socially connected to people in this day and age in spite of social distancing. There are a lot of things you can do. Also, when you think about a panic like coronavirus panic or anxiety related to coronavirus, there are 4 groups of people who are immensely affected by a stress like this. The first group is people who have pre-existing mental health disorder or substance use. So what they end up doing is that if they already have a history of anxiety or depression, their anxiety and depression will be more. If they already have a history of substance use like alcohol or drugs, they will be using more. Our job as a physician, as a provider, as a healthcare worker, or even as a normal human being is to try to get those people more attention and more help. The second group is kids, and we can talk about it in detail later, but they are also affected seriously with this problem. The third group is elderly people, and of course, as we know that every single media outlet and everybody talks about higher risk for elderly, especially if you are close to the age 80, the risk of death is close to 15%, 14.9%. And the last group is us, healthcare providers. Healthcare providers are the front line. And our panic is very realistic because we have to work. Earlier, I was working in the emergency room. Not every ER has PPEs. If they have it, they have some masks, maybe some N95s, but not the full PPE you would ideally use. And because of that, this anxiety, this panic is very normal in our population, meaning in our subgroup, because we know that we are more prone to this, and we may be able to catch it much more easily than others. So this is all a fact. This is all something which we all worry about. Again, I'm not trying to be pessimistic here. We need to be optimistic, but these are facts, and we need to definitely look into the facts and see what we can do to avoid this panic, to calm ourselves down. Because remember, if we care about our kids, our family, if we are calm, we are role model to a lot of people. Others will be calm also. I'll end here.
Thank you very much, Asim. We had a little bit of a disruption in the last 30 seconds or so, what Asim was saying. Anyway, so
you want me to repeat?
We have attendees, and they, no, I think maybe it was on my side. So
Okay.
We have attendees who are using the chat option and they're posting questions. I have several questions. And the first question, I will pose it to Dr. Sajid Chaudhry. The question is that why this virus is different from SARS and MERS and how long it is going to persist.
Actually, this virus is from the same corona family. Coronaviruses are is a huge family of the viruses. They also cause infection in humans. Mostly we see seasonal respiratory infections during the winter most of the time. Rhinovirus, adenovirus, RSV, and also coronavirus. And usually symptoms are mild, like in the human family. They're like cough, mild fever, nasal congestion, and usually they recover on their own. MERS was transmitted from the camels. SARS initial, that was in 2000, I think 2000, early 2000. That's also corona family. And this one is suspected, started from the animals, mutated, and in the humans, and now it is infectious in the human. So this virus mutated from the animal virus, still the coronavirus. That's why it's given the name. It's called the novel coronavirus because of the gene mutation. Actually, it has mutated twice. First strain, which was usually animal coronaviruses, they are not infectious to humans, and human coronavirus, they are not infectious to humans, even you are living together or in contact with each other. But when it mutates, it develops an infectivity in the humans. So initial mutation, which is strain S, was causing infection to the humans, but it was not that lethal. Then it mutated again, which is called the L strain, which is highly infectious, of course, and it's a progressive virus, cause the more severe disease progression. We are getting this, we're seeing this pandemic because one thing is this, it's highly, infectivity is very high. You need a very low threshold burden of the virus to cause the infection. And second, we do not have, our humans body does not have any immunity against this virus. So even the few particles of the virus get into the respiratory tract, mouth, nose of any of the human, and it can cause the disease progression very rapidly. And we are seeing the symptoms, usually the people they get in the first 2 to 4 or 5 days. And mean incubation period to develop the symptom is like 4 days. And by the second day, the people who progress into the severe disease, they start having the respiratory symptoms like shortness of breath. And that tells us that it has involvements of the lungs. It starts with the periphery of the lungs and then spread very quickly over a few days. It can go into ARDS. And as Dr. Sajid Mahmood mentioned, people will be intubated. Most of the patients who are moderately symptomatic, we see in the hospital, they stay in that second stage where they are hypoxic. They need oxygen supplementation to maintain their oxygenation, and the rest of the supportive care, which is IV fluids and treatment for the fever, and then they start recovering eventually. We do, in the hospital, we do monitor their inflammatory markers to see the progression of the disease. Once they progress into the ARDS, then mortality is very, very high, extremely high. As we see, the overall mortality is like somewhere between 2 to 3%. With the age, elderly, above 60 to 70, is the mortality goes into 6-7%. And in Italy, we are seeing up to like 8%. But when somebody goes into respiratory failure, ARDS, the mortality is above 50%. So that's why you can see the difference of this virus. The previous MERS, SARS, the coronavirus, previous one we call this 2, and that previous one is 1. They were not that highly infectious, so they could not spread that fast and at that magnitude. This virus is highly infectious to humans, and that's why we're seeing this magnitude, pandemic of this magnitude. I will stop.
Thank you.
If I can add something to that.
Sure, but I just want to request our panelists to be a little bit brief because we have a lot of attendees and I see many, many questions. So let's be a little bit brief, but Asim, just go ahead.
Yeah, just a 30-second thing. The RO factor of this virus is 2 to 3 times higher than the flu vaccine or the flu virus or the MERS or so. So this becomes more contagious than any other virus. And also, the other problem with this virus is that other viruses may have had a mortality of 0.1 or so, but this has a mortality overall of over 1.2% or so. So that makes it more contagious and more deadly.
Very good. So Mr. Abdul Hamid, he is one of the attendees and he has asked a question and there are several other questions on the same topic. This question is to Dr. Asim Shah. Kids are off and staying home. All day they are told, don't go out, don't touch this, don't touch that. There is increased spike of panic and anxiety disorders. How do we handle those?
Yeah, that's a very good question. I'll try to be as brief as possible. Kids are, as I mentioned, people who are more affected with stress like this. And we have to deal with them differently based on their age. So if somebody is less than 5, the best is to limit media coverage, because when kids less than 5 see the media again and again and see these images again and again, they think this is happening again and again, although it may be the same thing, repetition again. Second, if they are over 5 and less than teenager, you may have to discuss with them, talk to them, be honest with them, explain to them the facts. Kids are much more smarter today than they used to be, perhaps in our ages. And last, if they are teenagers, they could be part of the solution. You can involve them in it. We need to teach our kids how to wash our hands. And the other thing is, if we are panicky ourselves, if we panic, if we hoard things, if we are doing all of that, kids are going to be more panicky. We have to be a role model. We have to discuss with kids the facts, the figures, and the facts are this virus started in China. China is better now. South Korea is better now. Even Iran is not as bad as it used to be. So those are the facts. If we tell them the facts, discuss openly, listen to them, then I think we can relieve their anxiety. That is the only solution around it.
Thank you. Next question is from Reno Khan. How likely am I to catch the infection when the whole family is locked in, but one family member must go out daily to attend office? What extra precaution to take? I will ask Sajid to address, Sajid Mahmood to address this question.
Okay. Yes. Thank you, Harun. I have answered and typed my response on the web also, so she might help. But for the other attendees, let me rephrase that. Of course, people are going to work. The ideal situation is to limit movement so that we can prevent transmission of viruses. But of course, those like we healthcare professionals, we have to be at a workplace. I know that some of the physicians have canceled their offices and they are doing on tele clinic and tele interaction. But some emergency room physician, anesthesiologist, and like myself, we have to be at workplace, even cardiologists and other professionals. So what have been recommended and what we are following, that we are using clothes that can be easily and frequently washed. I think the scrub suits is better. If some people is related to other field, they can also choose and get similar clothing from outside. The frequent hand wash is the key, at workplace or at home. And also when you come back, ideally, if you can take a shower and wash your clothes at workplace, that would be best. But if you get home, then without doing anything and get a shower and take off your clothes and wash it right away in hot water and with detergent. Plus the shoes need to be left out if possible, or at least in the garage area. And these are the precautions we are offering. And for I can speak for the healthcare professional that, of course, at workplace where you are supposed to, or you are likely to interact with potentially infected people. So we are using this PPE, which is personal protective equipment, as recommended by CDC and our state departments.
Thank you. Just a statement to the attendees. If attendees want to directly ask a question, there is a little on the chat, they can raise hand. If they raise hand, I will be able to see them and I can accommodate some of them to ask direct question as well. The next question is, if I have a fever or cough, when do I know that it is time for me to go to the hospital? I will ask Sajid to answer that question.
I mean, Sajid Chaudhry, Sajid Mahmood.
Sajid Chaudhry, sorry, Sajid Chaudhry.
Thank you. As I said before, the mild symptoms, most of the people, patients infected with this disease will develop mild symptoms like body aches, fever, which can be monitored at home, and their symptoms will resolve spontaneously. They should be checking if they can do that, pulse ox if they feel short of breath. That's a time when they should be concerned. And they can check their pulse ox at home. There's a small pulse ox meter available from all the pharmacies. If their pulse ox start dropping somewhere between 90 to 90 or 95, then they are like more symptomatic. And as soon as they start dropping below 90, immediately they need the oxygen. So simple answer will be, if they feel shortness of breath, they should seek for the medical attention. Thank you.
Thank you very much. My next question is to Dr. Asim Shah. Physicians and nurses are at the forefront of the battle, and their morale is not high, as they are seeing their colleagues getting sick and in some cases dying. What they should do to stay mentally strong?
That's a very important question, and we all are suffering from that. We see our colleagues who are mentally exhausted, working in the emergency room, working in ICUs, or the forefront nurses who are screening, and they're worried that even if they're wearing a surgical mask, is it enough? Or they're wearing a N95, is it enough? What's going to happen to them? Would they catch the infection? So there are numerous things we can do about it. First of all, of course, we need to try to protect them with PPEs as much as possible, and the guidelines about PPEs continue to change. They used to say surgical masks are not that effective for us, but now they're saying that even first responders. Just 3 days ago, American College of Emergency Medicine said that in the emergency room, everybody needs to wear surgical masks. So that's one change. I think because now this infection is becoming more common, from droplet to maybe even airborne to some extent. Second thing is that we need to support our physicians in first line. So for example, in our hospital, we have started numerous support groups. We do twice a day support groups at 8 in the morning and 8 at night, so that both shifts can join in. We try to listen to them, we try to support them. And if some of them need more mental health coverage care, we provide that. We provide that free, actually. One more thing the families can do is the families need to be more respectful of people who are the front line. Maybe listen to them, maybe give them some break when they come home, maybe give them some anxiety relieving stuff, don't stress them further. But yes, they are at the forefront, and if we don't identify any stress in them, that's going to be a big mistake, because we don't know how long we're going to be in this. Maybe 8 to 12 weeks, nobody knows, but we are in this for a while, and we need to take care of our mental health, especially the first responders.
Thank you. Dr. Jamil Mohsen asked a question: how soon after recovery from COVID-19 one can go back to work? I'll ask Sajid Mahmood to answer that question.
Yes, I also typed the answer. I think, and I will request Dr. Sajid Chaudhry also to correct me. I have heard that even though there are not routine tests being performed to check whether they are negative at the end of treatment, but once the test is negative, the virus continues to shed for 2 weeks. So I guess once people have completely recovered from their illness, 2 weeks is a safe time. After that, they can go back to work. But I will let Dr. Sajid Chaudhry also to comment on that.
Yes, I agree with Dr. Sajid Mahmood regarding this mildly symptomatic patients who are staying at home do not need medical attention after their symptoms recover. 2 weeks is the safe period. But the patient with the moderate symptoms, moderately symptomatic, moderate to severely symptomatic patients is 4 to 6 weeks.
Thank you. The next question is, this is by Shabana. If this virus can be aerosolized, why do they recommend not to wear masks? Sajid Chaudhry.
Actually, it is recommended to wear the mask. Any patients who is symptomatic, even they are staying at home, they are advised to use the mask and isolate from the family. Do not share the bathroom. Do not share any utensils or any area space, and they should be regularly cleaned. Even the hospital, the patients when they are like moderately symptomatic, or then they are intubated or more aerosolized. We use the N95 mask and the surgical mask at the minimum, and the most N95 mask. So masks.
Sajid, I think the question was more about regular, ordinary people. Should they wear mask?
For their own protection, if they're going out, they're expecting there's the exposure, yes, they should be using a mask. But if there is no exposure with the possible expected patients, then there is no need. So let me give the simple answer in a way. If somebody is coughing or sneezing, so they are the one producing the droplets, and there will be, usually they stay within 3 feet. So if somebody is away from the infected person, and the person is not coughing or sneezing out there, so not everybody is needed to have the mask.
Very good. The next question is, why hypertension, diabetes is a risk factor? What if the hypertension and diabetes is controlled and no complication? Is that still a risk factor? Sajid Mahmood.
Okay. Yes, based on the experience that we have already saw, and I reviewed some literature, those are not reported as strong risk factors to get or worse on that. The risk factors which have been reported and experience is mainly related to pulmonary illness like COPD or asthma or immunocompromised status, because if someone is receiving post-transplant medications or some other sort of immunosuppressives for some other conditions. Because as I mentioned earlier in my opening statement, that the main course of illness that COVID-19 is creating trouble for, it's mainly by lung complication. You know, almost all of them are presenting with respiratory symptoms with pneumonia, requiring with or without ventilator support. So yes, diabetes is considered in a broader sense, in a theoretical basis, that it decreases your immune response in the long run. So in that way it can, but per se diabetes is not considered as a strong risk factor for that.
Thank you. My next question is to Dr. Asim Shah. What will be the long-term impact of COVID-19 quarantine, COVID-19 quarantine on our children, and what can we do to minimize it?
Yeah, that's a very good question. There are two impacts. One is the impact of quarantine. The other is the impact when you come out of quarantine. So the long-term impact of quarantine, of course, we're going to see because we haven't had a lot of people in quarantine for a long time that we can see the long-term impact. Based on other scenarios like that, we know that when people are restricted, confined to one location, there is a lot of feelings which they have, which includes guilt, which includes neglect, which includes abandonment, which includes stigma, that everybody has isolated me, nobody wants to talk to me, touch me, and especially it happens more on kids, because while adults would understand that I am isolated because of A, B, and C reason, kids may not have that capability to understand that they are isolated, they are in confinement because of these reasons. So they will have a lot of anger, they will have a lot of abandonment issues, and a lot of psychological issues down the road. Now, when people come out of quarantine, then there is a second set of symptoms they feel, which is guilt again. The guilt is that I may not be able to work, I may not be able to be productive, I may not be able to help my family, I may not be able to be emotionally in contact with my family and others. And also, even if you come out of quarantine, there is some hesitance, there is some stigma that people don't want to talk to you or touch you or shake hands with you or hug you, even if you're a family. Shaking hand is not advisable right now anyway, but even your family and people who are near and dear to you may have a distance towards you even after quarantine, which is very, very depressing for a lot of people. So different set of complications and more we will see, but it is a very important question, and I think we need to look into that and look into the fact that if somebody's off quarantine, maybe we need to not consider them as they are to be completely socially distanced. They should be distanced, but the same way as we were doing before.
Thank you. Next question is by Hala Salim. This is for Dr. Sajid Chaudhry. Is malnourishment like iron and zinc deficiency can decrease immunity? If that is true, we are in a big problem because a lot of young people in Pakistan are malnourished. What should we do?
Well, at this point, I don't think anything that we can do for the patients who are being infected to improve their immunity or nutrition. Yes, people who are, as Dr. Sajid Mahmood mentioned, like uncontrolled diabetes, cardiac conditions, lung conditions, they are at the same risk of acquiring a disease as anybody else, but the disease can be more severe and progressive in those individuals. Same with we can speculate about the malnutrition people. If they acquire the disease, their body may not be able to fight the disease. Like most of the time, we see the people with the mild symptoms and they recover on their own. They develop the immunity, though we have not proved it yet, but as 90+% people, they recovered the disease from the continuously. So that tells us that our body does produce immunity against the disease. So that helps. So if somebody, majority of population, then there's nothing much that you can do other than to protect them from acquiring the disease. Thank you.
Next question is to Dr. Sajid Mahmood. What is the status of vaccine for COVID-19? How far are we from getting it?
Yes, so that is also very burning question right now among the healthcare professionals, especially with the magnitude of disease that we are experiencing. And I did talk to one of my infectious disease colleague, and I guess the vaccine which is in the process by one, I'm forgetting the name of that pharmaceutical company, but still it's in the process of making. And once after it's manufactured, I think they have to verify it and make sure that it is effective and it will not come with any adverse reaction. So that process with FDA can still takes another 6 weeks. So if he guesstimated a period of 6 weeks at least, it can be more. Now there are rumors, or I would say hearsay, that China has built a vaccine or manufactured a vaccine, but I have not much information about that. So the brief answer to the question is that I don't see it coming at least 6 weeks from now.
Very good. We are almost running out of time. I think we have an opportunity for a couple of more questions. This question is for Dr. Asim Shah. This is, we can avoid most of these social events, but what about going to funeral of a near and dear one? If we not go, this will be associated with the guilt. So what to do about it?
Yeah, that's a very good question. You know, the current guidelines are 10 people and more, and less. And we have had numerous funerals actually in Houston. Unfortunately, even the funeral places or the cemetery didn't even allow more than 10. And you can imagine 10 is no number. Even your own family is more than 10. So the guilt and the regret and everything associated with that is definitely more depressing. But just think about it in the same context that as we grew up, we always thought that our holy place, Makkah, would always have people praying there. That's also at a standstill right now. So if things like that can be at a standstill, unfortunately, we are doing it to protect humanity. We are doing it to protect other human beings. While there are a lot of emotions attached to it, there is no other way to do it. Now, one thing people have done and have been encouraged to do, that if there were more than 10 people at a funeral or so, then we need to divide time and say that 10 can come between 1 and 1:15, the other 10 can come between 1:15 and 1:30, and so forth. The only problem with that is that our population usually does not listen to these things, and they may
Asim, you got muted. Thank you. I think you got muted in the last portion of 10 seconds. We still can't hear you. I apologize. Our last question, I think Sajid, Mahmood or Sajid Chaudhry, whoever wants to take it. When do we expect all this to be over? Either Sajid.
Okay.
Go Sajid.
Well, the thing is that, oh, who is, I'm hearing some voice.
I think somebody is not muted. Go ahead.
Okay. So I think right now there is no clear answer for that, but we can, the most of the healthcare professionals and the experts, they are predicting that once the new cases stop coming, then you can predict. And we have seen that happening in China, that the day when the new cases stop coming, and after that, you know, they were able to control that, and now the number is stopped, and you know, there is no new case. Even though there have been reports that now there is a second wave of new cases, but those are from travelers who are visiting China from outside. So that's what we have to wait. And until then, I don't see that anybody can predict when it's going to be over. But I will let Dr. Sajid Chaudhry also, because it's more related to infectious disease. So maybe if he has any better prediction.
Yes, actually, we can predict to end this pandemic by complete distancing or lockdown. So if that happens, usually it will take at least 2 to 3 weeks, or maybe 2 to 4 weeks, unless that is not happening, because in the community cases are being more and more cases, people are being infected. So that you have to stop the source to the susceptible person. So that's model we learned from China. They completely stopped the source going towards the person who can be infected. Unless we do that, it will keep on progressing. And unfortunately, we are heading towards that. I just heard that tri-state area has been locked, so nobody can go in and out of that states. So we need to do complete house stay, complete ban in and out from the areas which are infected to the areas which are not infected. Keep the source and the person who can be infected separate, and then you can expect 2 weeks, and then we will start declining, seeing the decline in the disease. Thank you.
Thank you very much. This concludes our today's webinar. Inshallah ta'ala, we will have more of these webinars. Soon we will make announcements. I want to ask Nahid if she wants to thank the panelists, our guests, our attendees, and any final words. Dr. Nahid Usmani?
Can you guys hear me?
Yes.
Yes.
So I really thank all the panelists. They were very patient. Dr. Sajid Mahmood, Dr. Sajid Chaudhry, Dr. Asim Shah. I think your answers are very informative and right on point. It is amazing that we had people joining from US as well as in Canada. There was one question that rang deeply in my heart, which was, how long is this pandemic going to continue? Because as of now, we are waiting, when can we have our annual meetings and continue the work? Thank you, Dr. Harun Durrani, for arranging this very informative session. Inshallah, I look forward to having you arranging many more of this. I thank all our guests, Dr. Rizwan Khalid, His Excellency Asad Majid Khan. It's really important that the leadership was here. Inshallah, we will continue to participate in these webinars, and good night. Thank you.
Good night, everyone. Assalamu alaikum.
Thank you, everyone.
Thank you.
Thank you. Thank you.